What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Ken. But if this is the first time you're seeing this channel, don't forget to subscribe. Today we're going to discuss about the Pterygopalatine Ganglion, which is one among the four parasympathetic ganglia of the head, and this is your Pterygopalatine Ganglion. As we've said, it's one among the parasympathetic ganglia of the head, and it has got a number of names, and this includes the Sphenopalatine Ganglion, the ganglion of hay fever, the Meckel's ganglion, the nasal ganglion, and some other names that may be applicable to this pterygopalatine ganglion. The pterygopalatine ganglion is located in the pterygopalatine fossa. So this is the pterygopalatine fossa. Okay, so as we've said, it's one among the four parasympathetic ganglia of the head. What are the other three? We have the ciliary ganglion, we have the aortic ganglion, and submandibular ganglion. Together with the pterygopalatine ganglion, they're making four ganglia of the four parasympathetic ganglia of the head. These parasympathetic ganglia, they are relay center for the parasympathetic fibers. Remember, what is the ganglia? Ganglia is a collection of neural cell bodies outside the central nervous system because they are outside the brain. Now, what are the general organization of this parasympathetic ganglia? We've seen already that every parasympathetic ganglia has got three main contributions. We have the sympathetic contribution, parasympathetic contribution, and the sensory contribution. And remember that the sensory contribution is mostly the topographical connection rather than functional, meaning that it suspends this ganglia. And we have said this parasympathetic ganglia of the head are being suspended by the sensory branches of trigeminal nerve. And today we're seeing the pterygopalatine ganglion. We're going to see that it's being suspended by the second branch of trigeminal nerve, which is called the V2 maxillary nerve. The maxillary nerve is suspending the pterygopalatine ganglion, and we've said the output is mainly motor, which is GVE, general visceral efferent, which is going to act as secretomotor and the vasomotor. Secretomotor is going to the glands, and it's mainly from the parasympathetic, but the vasomotor is coming from the sympathetic and is going to supply this smooth muscles and the blood vessels. Smooth muscles and blood vessels. Why are these ganglia suspended by the trigeminal nerve? To reach to different places of the head, because the trigeminal nerve is the chief sensory supplier of the head. The chief sensory supplier of the head. We have said we have three contributions to this ganglia, but the only contribution that is synapsing within the ganglion is actually the parasympathetic. Only the parasympathetic part is what is synapsing within this ganglia, because these are the parasympathetic ganglia. They are the relay centers for parasympathetic parasympathetic fibers, and so the only component that is synapsing here is going to be the parasympathetic. That the sensory fibers synapse here? No. Do the sympathetic fibers synapse here? No, they do not. Only the parasympathetic fiber is going to synapse. So this is your pterygopalatine ganglion, and we've said the main output from this ganglia is going to be the motor, GVE, general visceral efferent, but mainly two components, the secretomotor and the vasomotor. Secretomotor to glands and vasomotor to smooth muscles of the blood vessels and blood vessels of these glands. And we also have sensation, but I've told you the sensation is not actually the functional component of this ganglia. They are connected. This is where these nerves are suspended. Okay, so they are taking sensation from different parts of the nose, the nasopharynx, and some other region that you are going to see. So this is the pterygopalatine ganglion. As we said, the pterygopalatine ganglion is located in pterygopalatine fossa. Okay, the pterygopalatine fossa. So this is anteriorly bordered by the maxillary air sinus. We have maxillary air sinus anterior to the pterygopalatine ganglion, which is the pterygopalatine fossa, and posteriorly we have the root of the pterygoid, the root of the pterygoid process posteriorly. Anteriorly is maxillary air sinus. Posteriorly is the root of the pterygoid process. medial is being bordered by the perpendicular plate of the palatine bone, and laterally is being bordered by this the pterygomaxillary fissure, a fissure between the pterygoid process and the maxilla bone, and these are the boundaries of the pterygoid ganglion, which are also boundary of the pterygopalatine fossa. So this is what I was saying, like the pterygopalatine ganglion. This pterygopalatine ganglion has been suspended from V2, which is the sensory branch, and this is your V2, and it's related to maxillary air sinuses, with which maxillary air sinus is anterior to this pterygopalatine ganglion, which is the pterygopalatine fossa, and then immediately we have seen we have the perpendicular plate of the palatine bone. So this is a snapshot of this ganglion, the pterygopalatine ganglion. We have the nerve, the sensory fibers which are carried by the trigeminal nerve, but if I have to be specific, is maxillary nerve of trigeminal nerves is suspending the pterygopalatine ganglion, and we also have the facial nerve that is supplying this ganglion, and also have the sympathetic that's going to supply to this pterygopalatine ganglion. But I want to talk each one in turn, starting with the sensory root. We have said the sensory root is coming from V2, which is the branch of trigeminal nerve, and is suspending this pterygopalatine ganglion. We have said this ganglion will be suspended by the sensory branches of trigeminal nerve, and now in pterygopalatine ganglion, the sensory nerve that is suspending this ganglion is maxillary nerve. So do these fibers from maxillary nerve synapse in this pterygopalatine ganglion? No, they do not synapse, because the only component that is synapsing this ganglion is going to be the parasympathetic fibers. Only the parasympathetic fibers are going to synapse in this ganglion. Next, let's see the parasympathetic fibers. Now the parasympathetic fibers are coming from the facial nerve, and from facial nerve they're being carried by the greater petrosal nerve. And the greater petrosal nerve is going to join the deep petrosal nerve. The deep petrosal nerve, we haven't discussed it, but the deep petrosal nerve is carrying the sympathetic nerve fibers, and then they are going to join to combine the greater petrosal and the deep petrosal. They are joining together to form the nerve to the pterygoid canal. This nerve is called the Vidian nerve. Now, all these to the Vidian nerve, they are carrying the preganglionic parasympathetic fiber. Remember, the ganglion that we are talking about today is the pterygopalatine ganglion. So the fibers which are coming to the pterygopalatine ganglion, they are called the preganglionic fibers. Okay, but that's parasympathetic. So we have the preganglionic parasympathetic fibers that are carried by the facial nerve, but they are getting here by the way of the greater petrosal, which is joining the deep petrosal to form the Vidian nerve, and the Vidian nerve is going through the pterygopalatine ganglion. Do these fibers synapse in the pterygopalatine ganglion? Yes, because the parasympathetic fibers, they are only component that are synapsing within the pterygopalatine, within this parasympathetic ganglia of the head, and then the postganglionic fibers, after synapse within the pterygopalatine ganglion, the postganglionic fibers, they are also being carried away by the branches of V2, branches of maxillary nerve, and we see so they are going to different places. We have the glands within the nose, which are called the nasal glands. We have the glands within the nasal pharynx. We have the palatal glands, and also have the lacrimal glands. They are all being supplied by these branches that are coming from the pterygopalatine ganglion through V2, through V2. So let me show you here. For example, this is the pterygopalatine ganglion, this is V2, and then you see we have a branch of it which is called the zygomatic nerve, and the zygomatic nerve is going to join the branch of V1. Okay, so we have fibers that are coming from V2, from the pterygopalatine for ganglion through V2, and they are joining with V1 to supply the lacrimal gland. What is the function of the lacrimal gland? Let me take you back here. What is the function of the lacrimal gland? Secreting tears, and then we have the nasal secreting the mucus and all the stuff that are coming from these ganglia. Okay, next is gonna be the sympathetic contribution. Now the sympathetic contribution to these the pterygopalatine ganglion, they are coming from the superior cervical ganglion. Remember, the sympathetic is thoracolumbar. There is no any sympathetic that's coming from the head. If you need to have the sympathetic within the head, you need to borrow it from the superior cervical ganglion, from the neck region through the superior cervical ganglion. And these ganglia, these fibers are carried to the head by the way of blood vessels. They are forming plexus around the carotid artery. They are forming the plexus around the carotid artery to go to the pterygopalatine ganglion. But remember that the sympathetic, they have their own ganglia. Okay, and the highest one is called the superior cervical ganglion. So the fibers that are coming from the superior cervical ganglion, they are already postsynaptic, which are called the postganglionic sympathetic fiber. So the postganglionic sympathetic fiber from the superior cervical ganglion are carried by the way of the internal carotid artery. They are carried through the deep petrosal nerve, and the deep petrosal nerve is going to join the greater petrosal nerve to form the nerve to the pterygoid canal, which is called the median nerve, and the median nerve is going to aortic ganglion. And these fibers, they do not synapse within the pterygopalatine ganglion because they are already postganglionic. They are already postganglionic sympathetic. Why? Because they have their own ganglia here, which is called the superior cervical ganglia. Okay. So, and then from there it takes the same routes to go to the same gland that was supplied by the parasympathetic. And this have said the sympathetic is more vasomotor, which means it's going to result into vasoconstriction, constriction of the blood vessels, but also they're going to regulate the secretion from the glands that they are supplying, and that's going to be the sympathetic. So sympathetic is same, superior cervical ganglion through the internal carotid artery, through the deep petrosal nerve. They're going to join to greater petrosal to form the nerve to median, nerve to the pterygopalatine ganglion, which is called the median. Let me take you back here again. Let me take you back here. Okay. So this is the pterygopalatine. This is the pterygoid canal, and this is your median nerve, and the median nerve is formed by, you see, we have the median nerve, which is formed by the greater petrosal and the deep petrosal. The deep petrosal is coming from the internal carotid artery. You can all see we have plexus. Okay, let me take you from here. Well, this is superior cervical ganglion. The superior cervical ganglion is forming plexus around the carotid artery, and these plexus are going to emerge at the deep petrosal nerve, and the deep petrosal nerve is going to join the greater petrosal nerve to form the nerve to the pterygoid canal. This is the pterygoid canal, and this nerve is passing through the pterygoid canal. So this is called the nerve to the petrosal pterygoid canal, which is also called the median nerve, and is going to join to the pterygopalatine ganglion. And then from pterygopalatine ganglion, you see we have the nerve fibers that are going to different directions. We have those are going to the nose, we have those are going to the nasal pharynx, we have those are going to the palate with the palatal glands, and some are going to the lacrimal gland to supply the lacrimal glands. Okay, so we have a strange condition here which is called the crocodile tear syndrome, and the crocodile tear syndrome is also called the gustatory lacrimation or Bogoradi syndrome. It has got a number of names, but what is it? This is a condition which is associated with the shedding of tears when you are eating or thinking of food. Whenever you are eating or thinking of food, you are shedding tears, and this only resembles to the tears of the crocodile because it is historically believed that crocodiles shed tear while they are eating their prey. And this doesn't mean that they are feeling pain, no. And this is why this condition is called the crocodile tear syndrome. How does it happen? This happens by aberrant nerve regeneration. And which nerve? That's your fascial nerve. Listen, you have injury to the fascial nerve, and remember, let me take you back. Remember, the fascial nerve is supplying the sublingual and the submandibular gland through the chorda tympani. Remember? Yes. And then the same fascial nerve also supplies through the greater petrosal nerve. It supplies the pterygopalatine ganglion. The pterygopalatine ganglion is supplying the lacrimal gland. Okay. So we have the salivatory pathway and the lacrimal pathway. So someone is getting injury to the fascial nerve, and while the fascial nerve is healing, there occurs misdirection of fibers. The fibers that we are going to supply the sublingual and submandibular gland, they are going to supply the pterygopalatine gland through the greater petrosal nerve. And then what happens, because this was salivatory, they were associated with gustatory, they were associated with tasting and thinking of food. Whenever you're thinking of food or you're eating, these fibers, they are going to stimulate the pterygopalatine ganglion. The pterygopalatine ganglion is going to stimulate the submandibular, the lacrimal gland. And then what happens? You are shedding tears while you are eating instead of secreting saliva, and this is called the crocodile tear syndrome. And it is very disturbing to, assume again is almost the same as the phrase syndrome. Like you are going to, celebrate your friends, and you're invited into different places, and while you're eating, you're shedding tears. Okay, so it can be treated with botulinum toxins, when they inject into the lacrimal gland, and that's your crocodile tear syndrome. Pterygopalatine ganglion is related to the group of headache disorders which are called the trigeminal autonomic cephalalgia. And the research shows that blocking the pterygopalatine ganglion results into improvement of these headaches. And these headaches include the cluster headaches. We have mentioned prior that the pterygopalatine ganglion is also called the ganglion of the hay fever. But why is it called the ganglion of the hay fever? It is because this ganglion is supplying the nasal glands, and the nasal gland, they have hypersecretion in hay fever, and the hay fever is also called the allergic rhinitis. So in the situation of allergic rhinitis, we have a lot of secretion of the mucus. And this hypersecretion, because they are being supplied by the pterygopalatine ganglion. That ganglion is related to this allergic rhinitis, which is called the hay fever, and so this is called the ganglion of hay fever. That sounds like pretty much it from today. And if you've enjoyed this discussion, don't forget to subscribe and share this video with your friends, and stay tuned for more videos to come. Hi, it's NeuroSketch TZ.